and welcome to Diabetes Connections in the News. I'm Stacey Sims, and these are the top diabetes stories and headlines of the past 7 days. If you're new, welcome. We go live on social media first, and then all sources are linked up at diabetes-connections.com when this airs as a podcast. Are you looking to get organized? Check out my new guide with top tips to clear your diabetes clutter, everything from how to start to where to donate and how to keep it from taking over your house. Head over to diabetes-connections.com to get organized. Our top story this week, among people with type 2, minority ethnic groups have more limited access when it comes to newer diabetes medications. This study used data gathered from 2005 to 2019 in a large clinical trial conducted at Johns Hopkins and other sites across the U.S. They found that compared with white patients, all minority groups were less likely to start newer diabetes medications. Black patients were 20% less likely to start, and American Indian or Alaskan Native patients were 50% less likely. And the researchers stressed the findings were not driven by the patient's income. It didn't matter how much money they made. And they say their next step is to look at how insurance coverage impacts which diabetes medications get prescribed and to whom. Billionaire Mark Cuban has opened up an online pharmacy offering prescription drugs at cheaper prices. Insulin isn't included right now, but there are some diabetes medications listed. Mark Cuban Cost Plus Drug Company says they want to, quote, bypass middlemen and outrageous markups. Cuban is not the first to enter this market. It is a highly competitive one with contenders like GoodRx. There was a really good write-up about the stress of parenting a child with type 1 diabetes and what can be done about that. This is an endocrinology advisor. They spoke to pediatric psychologists and endos, familiar stories of no sleep, fear of hypos, and of future complications, but also some good information about how the stress changes over time and over the child's life, acknowledging different challenges that face parents of very young children compared to those of teens. Now, not a lot of solutions here, but very good reading about supporting a parent's well-being as well as the child's. Obesity is a main risk factor for developing type 2 diabetes, but it has not been previously seen as a major complication in type 1 diabetes. However, a new study shows that obesity rates in adults with type 1 are increasing and mirror the rates of the general adult population. These researchers, also at Johns Hopkins, say adults with type 1 also now have a higher risk of kidney disease than those with type 2. Middle-aged men who are anxious and worry more may be at greater biological risk for developing heart disease, stroke, and type 2. This altogether is called cardiometabolic disease. This study used a long-running research project started in 1961, mostly including white men. They followed different groups of men through 2015 and measured worry through questions and surveys. Higher worry levels were associated with a 10% higher likelihood of having 6 or more cardiometabolic disease risk factors. These researchers say it would be important to follow up to see if these associations exist among women and people from diverse racial and ethnic groups. No word about what these guys might do for the worry itself. Big slap for Eli Lilly from the FDA. They say an Instagram ad for the type 2 diabetes drug Trulicity was, quote, misleading and particularly concerning. Lilly has since deleted the post in question, but the FDA says it failed to adequately communicate the indication and limitations of use associated with Trulicity. The FDA says it was alerted to the post via complaints to its bad ad program, and the FDA says this isn't the first time it had to warn Lilly about the Trulicity ads. MIT engineers are working on a couple of devices to streamline some of daily diabetes tasks. This got a lot of buzz in the past week, but it is in the very early stages. So here's what they're working on. They have one device that takes a photo of your food, calculates the carbs, measures your blood glucose via finger stick, then calculates the dose for insulin and gives the injection. That's all in one device. The second device is all of that, and it's set up so that the blood glucose measurement and insulin delivery happen through the same needle. As I understand it, this would be like giving an insulin injection through a CGM wire. We'll see if it gets out of the lab and into clinical trials. Before I let you go, our long format episode this week is with Tandem Diabetes. They released an ambitious 5-year plan to add a tiny pump they're calling Mobi and eventually to move to a tubeless system. And that interview can be heard in this past episode just this week. And next week, we're talking about what it's like when type 1 is just one of the autoimmune conditions you live with and the other one makes it very difficult to get a COVID vaccine. You can listen wherever you get your podcasts. And that is in the news for this week. If you like it, please share it. Thanks for joining me. I'll see you back here soon.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.